systematic meta-analysis when during my postdoc era at the Center for Respiratory Health Research at the University of Oulu, Finland. In fact, I had my master's in Luleå University of Technology, Sweden, then the PhD at the University of Birmingham. Then I went on for the postdoc in Finland. I joined the University of Ghana in 2014, March. I remember very well. And I've been involved in some capacity building in the area. I've also worked for WHO, especially in their development of a guideline on schistosomiasis. I did some systematic meta-analysis for them. My major area of interest in environmental health. I do a lot of air pollution, but household air pollution more. I also have interest in climate change and health, urban health, and farm health as well. And anything that affects, any environmental aspect that affects a vulnerable population is also of interest to me. And also methods of systematic review and meta-analysis. I'm very happy to be part of this program today. And I'll do my best to offer any experience that I have so far this course is concerned. And I want the course to be very interactive. I don't know how I'm going to do, but at least if you have any question, you can interrupt as I go on. I've spoken with Rosalind and Fortune, and we have suggested that this course will be broken into two. I'll do the first phase up to how to turn your research questions into a search strategy. Then probably next time they'll come up with the new dates. We'll continue from searching in the database up to the end of systematic review. Yes, to begin with, systematic review is becoming very popular these days, especially from both funders and also for policy and also for decision making. And it's very important if you have some experience in conducting systematic review. Sometimes I know in some universities, some PhD work are basically based on systematic review and meta-analysis. So I think it's a right thing for us to have a chat on how to do a systematic review. Yes, the overall goal of this, I hope that by the end of this session, both phase 1 and phase 2, for phase 1, we recognize the features of systematic review and also how to, and it's important as a research design tool, and so be able to identify elements of well-defined research questions, and then understand and develop search strategies and be able to turn your research questions into search strategies. So there's the whole thing that you are going to do today. By the end of the discussion, I hope we'll be able to achieve this. Okay, so the first question that you may want to know is, what is a review? I'm sure this is something that we are all familiar with. You know, a review is a generic term for any attempt to synthesize one or two evidence on a particular topic, right? It's a very generic term that is used in several disciplines. And the question is, why do you conduct reviews? I'm sure you all have an idea as to why we conduct reviews. One, we are in an age of information explosion. We have very little time to do whatever we want to do. For example, if we look at some major countries like China, UK, for example, tons of publications are coming from these countries on a daily basis, and it's growing exponentially. And these are only how many? About 7 countries. And so if these countries are, only 7 countries are producing volumes of information, and let alone other countries. So we are in an age where information is abundant. We have a lot of information and very little time to even read all those information. For example, Elsevier alone produced about 800,000 articles a year. And so then we come to the Taylor and Francis, and then Frontiers. You can count the several outlets that we have in the academic arena. So a lot of articles are coming out on daily basis and also on annual basis. So it's always difficult to make decisions. On PubMed, for example, on daily basis, we get about 30,000 articles, which are dumped in PubMed. And so if you want any particular information, you can, let's assume that in your field, you have about, let's say, 40 articles dumped in PubMed a day. Will you be able to read everything? It's very, very difficult. And some of this information, some of them are just junk. They are not very relevant to the investigation or the topic that you want to carry out. And more importantly, I know this is also in other disciplines. There are tons of so-called untrustworthy articles, faked and flawed results that are published in these outlets on a daily basis. John Khalid reviewed about 500 randomized control trials. And out of those, you realize that 44% of these trials used flawed data. And then 26% are deep-rooted in flaws. And so what it means is that most of the articles that we chance on, most of them might not be credible. And so if you need a very systematic way of identifying which article to include in making decisions, else if you end up adding oranges to apples, then the result that will come will affect the decision that you make. So it's very important that we have a lot of information, not all of them are credible. So we need a very systematic way of identifying at least the most important ones, the credible ones that we can use now. That doesn't mean that if you do systematic review, you can avoid all the incredible ones. At least you can minimize the amount of fake information you add to your study. And so that suggests that it's always very important to do a systematic review instead of. So you have in this graph, we have the systematic review and meta-analysis. You can have purely a systematic review without a quantitative analysis, which means you can only do a narrative synthesis of the evidence. And then you can have only a quantitative analysis with no systematic or qualitative synthesis. But in between the two, you can have a systematic review and meta-analysis. In fact, any meta-analysis without systematic review I would say, it's not a very credible one. Every good meta-analysis should have a component for systematic review because of the systematic way in which studies are identified and included in the way. And so that in some cases, systematic reviews and meta-analysis are used interchangeably. Sometimes you see a paper that includes meta-analysis, but it's just tied to systematic review. Whereas other people think that systematic review refers to a qualitative synthesis, right? So these words, systematic review, meta-analysis, and systematic reviews are used interchangeably, right? So anytime the fact that you see a paper with a title systematic review doesn't mean it's only a qualitative synthesis. Sometimes it may have a component of a quantitative. So you need to actually go through the paper to check whether there's a quantitative element in it. So a narrative review, we all know, we've been doing this all the time. It's usually written by experts in the field. they use informal and subjective methods and to interpret the results. Now, this reminds us of a very famous Nobel Prize winner. Pauling has, I think he's among the 5 people who won more than 1 Nobel Prize. He's a chemist, a chemical engineer, a biochemist. Is well known everywhere. In the early years, they have a popular book called Vitamin C and Common Cold. And what they did was they did a narrative review, identified some few studies. They came up with a conclusion that taking a large dose of vitamin C on a daily basis can prevent common cold and its associated symptoms. This book became very, very popular, and doctors and healthcare workers were using the book because of the credibility of the person who wrote the book. Now, later on in the years, Emila and a colleague did a systematic review of about 29 trials. 4 of them were included in Pauling's narrative review. And then they actually refuted the claim that was made by Pauling. There was no evidence that vitamin C can help cure cold and its symptoms. Now, so a narrative review, the reason why I brought this up is that a narrative review, you are a bit selective in your choice of papers. And then the conclusion might be different. For example, you might decide to pick articles that probably meet your expectations or the way you think. And then you can draw a conclusion on them. And so another person can do the same work around the same time, and it might probably arrive at a different conclusion. But a systematic review, which is reproducible, will always give a conclusive matter to the issue. So in this case, a systematic review that is conducted later on came to the conclusion that there was no evidence that vitamin C can cure common cold. Well, this is the reason why we always need to carry out a systematic review if we want to make policy decisions, and also some clinical decisions. So what is a systematic review? It's a review of a clearly formulated questions that use systematic and explicit method to identify, select, and critically appraise relevant research to collect and analyze the data from the studies. And so systematic review applies a very systematic, explicit way of identifying papers, explicit way of defining the research objectives, methods, and always with systematic review, the methods are always reproducible, provided you identify the same questions and the same topic that you want to also address. Right, so if you identify the same questions within the same time frame, then the conclusion will always be the same. But however, if, for example, I identify papers from, let's say, 1966 to 2010, and I reach a conclusion, and then you came into also the same papers, but you updated my search strategy and up to about 2025, then possibly the conclusion will be different. But within the same time frame, we expect that any two systematic review address the same question should arrive at the same conclusion, and the method should always be the same. So that makes systematic review more superior to the other forms of reviews. We're talking about meta-analysis. We know is a quantitative part of, so after doing your systematic review, then you need to reanalyze the data obtained from your search. Then you carry out on a meta, although it's also very, very important. So sometimes it gives a very valid conclusion to a subject that is a bit conflicting, right? So it's always important to also do a meta-analysis, which is outside the scope of this discussion. What are some of the applications of systematic reviews and meta-analysis? For example, in recommendations, WHO recently updated its air quality guidelines. It was downgraded, actually. And so what they did was to ask a group of researchers to conduct a systematic review and meta-analysis on different subjects. Then based on the evidence, they have a group that sat down to look at the evidence. They have external reviewers who also look at the evidence. Then eventually, based on the evidence available, they decide to downgrade the guideline that was developed in 2010. So some systematic reviews and meta-analysis are good for recommendations and also for guideline development. So it's a very useful tool. I'm part of the Ghana Standard Boards. We develop standards. We sometimes adopt, we don't develop, we adopt standards from other countries. And the last time, I think we just sometimes adopt without doing any systematic. Very good guideline or a standard should proceed with a proper systematic review and meta-analysis to understand the current scientific evidence, whether it supports, like the WHO case, whether it supports a downgrading or upgrading of the guideline. And sometimes also very important for policy decision making. For example, if we're torn between providing a program for community A, and you have, resources are very scarce, then you want to find out whether providing them with a strategy A against strategy B, which one is best and or cost effective. One systematic review meta-analysis can help you arrive at a decision which policy will support whatever decision you want to make. These days, to most funding agency will prefer that you do a systematic review to identify whether there's actually the need for a new research, right? So systematic review and meta-analysis are very useful for recommendations, for policy, for performance measures, and also to identify a research agenda, which is very important. And so that's more reason why the way forward these days is to understand and be able to interpret the result of systematic review and also understand the methodology of systematic review and meta, but they are very, very useful in several areas. In the quality of evidence, we know that systematic review and meta-analysis are always on top. They are even above the golden standard, the randomized control trial. So what that is to say, if you conduct a systematic review and meta-analysis of randomized control trial, it's always superior. It can even, at that top there, you can even break it up into two. You can have systematic review from randomized control trial being at the top, then systematic review and meta-analysis of observational studies. Definitely, systematic review and meta-analysis of randomized control trial will be superior to systematic review of observational studies. But in any case, systematic review and meta-analysis are always on top of the quality of evidence, but they are very, very credible, then followed by a randomized control trial. And that's it. So it's, when it talk about quality of evidence, it's always very, very, it's on top. It's very useful. So it's, I think it's in place that this subject is introduced in our part of the world. So we can understand the language to be able to conduct one. And I think also to understand it, to be able to interpret the result of systematic meta-analysis. How do you start a systematic review? You always will need a team. So the team composition should be somebody, who has some domain expertise. For example, if I'm doing something on air pollution and asthma, you expect that you should have somebody who has expertise in air pollution and asthma. So it's always important to have a domain expert, somebody who has expertise in the area. Then a methodologist, somebody who can also guide the systematic review. If at a student level, it's always important. We are assuming that if the student is working on a topic, he has a supervisor. The supervisor is the expert who's going to guide the students. And so, but if it's for a corporate or an institutional, an organization, then you should always have a composition like this. Then sometimes you also have involved the stakeholders, those who might be affected by decision from the systematic review and the meta-analysis. You have somebody also who can help manage the data of the systematic review and meta-analysis. So the first thing that we need is to form the team. And so normally it's a rule of thumb that in conducting a systematic review, we don't need one by one. We should always have more than one person, right? And as I said, you have a supervisor who's guiding you, so who is a person bringing the expertise, and also the so-called, who is also a methodologist. So this should always be the composition. Don't start a meta-analysis when these things are not in place. Right? You should always have somebody who has some expertise in meta-analysis and the subject. And so this is a structure of meta-analysis. You always will have to define your question. After the question is after the team has agreed that there's a question, you want to move forward, then you develop your protocol. Then after you have developed your protocol, you might want to publish your protocol in several outlets. We will look into that later. So first you have to define your questionnaire. The question, the research question, which is very key. The research question is just like a foundation of a house. It is tied closer to the search strategy. If you get a research question wrong, everything that follows it will be wrong. So the definition of the research question is very critical. It's just like a primary studies that we do. Your research objective or research question is very critical. Might the same way as in systematic reviews. The research question is very key of the systematic review. It's tied into the other parts of the processes. Now, we want to look at, we pick each 1 in 10. We want to look at question formulation and systematic review. Always a good systematic review is based on a well-formulated and answerable question. It's difficult even to define what is an answerable question, but at least we have a guideline. We have some guideline that will help us to know what an answerable question is, or what so-called a well-formulated question is. So a good research question, a well-formulated and answerable research question will guide the type of studies to be included in the review, will guide the search strategy, what should be the search strategy to help you identify the primary studies to answer the questions. Then it's also guide the type of data to collect to answer the question. So just like the primary study, the research question is a backbone of the whole entire process. So if you get it wrong, so you always have to take your time. And so the Council 1997 suggested that you ask a poor question and you get a poor review. Suggest that research question is always very key to your success. To getting a well-conducted systematic review, you need a well-formulated research question following a strict guideline. Now we're going to look at how to identify or formulate a research question. I hope you are on the same page. Is anybody behind? If I'm going fast, you let me know. A research question can be broad or can be narrow. And normally it's being suggested that a systematic review should have a well-organized and focused research question. But that's not always the case. For example, if you look at on the right the top right, you have a research question. What is the best strategy to prevent smoking in young people? Now, according to the guidelines of systematic review, this is not a well-formulated research question. But however, it's possible. For example, this may be suitable for a scoping review when you want to explore. Whereas a scoping review, this research question can fit a scoping review. Sometimes in Cochrane, sometimes they deliberately allow very broad questions, and they divide the questions into primary, secondary, and sometimes tertiary, where it's allowed. But at our level, we want only a primary objective or primary research question. Because sometimes once the question is very sophisticated, the form the research strategy becomes more sophisticated for a beginner. So we want to begin with a more simplified research question guided by let's say a formula, right? Doesn't mean that if you have a broad research question, if you had a broad research question, you enter in so many problems. Like experts, you can't do it. But for example, as I said, a question like, are mass media or school-based or community-based interventions effective in preventing smoking in young people? This is quite very, very direct. And we know why this is appropriate for a systematic review. And the other one, the broad one, is not appropriate for a systematic review. Then, does aspirin improve survival after acute myocardial infarction? Again, this is a very broad question, which again is very suitable for a scoping review. But if you want to do a systematic review that is guided by, let's say, a formula, we rather say inpatients with acute myocardial infarction, that's daily dose. You come to understand how to formulate when you have a very broad one. The same thing applies to, is zinc effective in treating common cold? All the questions on my right seems to be very broad. If apart from those being this fitting a scoping review research question, in some cases you can also do a systematic review on this. But again, as I said, it's not for novice, it's for extremely experienced systematic reviewers. For the work here is quite a lot, especially when it comes to turning the research questions into research strategies. It becomes very complicated. At our level, we say it's too broad. We need a more focused research question guided by some statements. Now, this is a very rough graph showing the relationship between research questions and search strategy. If you have a very broad research question, as we saw in the case in the previous slide, you retrieve a lot of articles. That's the first challenge you go through. You get a lot of hits, sometimes 10,000, 20,000, 100,000 hits. And assuming you do your first search in PubMed, you get about 20,000 hits, you get frustrated. Again, it tells you that your search strategy is not your search terms are not specific, right? They are not very, they probably don't follow a certain guideline. But if I apply all the guidelines following the formulation of research questions, then you'll be able to get an optimum. What is an optimum? An optimum research question is the one that follows the guideline for question development. Now, if your research question is too narrow, you end up missing important or relevant articles to answer your objectives. So there's always the need to follow a certain guideline to get an optimum question that will help you get quite a reasonable number of hits to start with. So always have this in mind. If your research question, if later on when you start your search and you are getting a lot of hits, it should prompt you that probably your research question or a search or your research question to start with is too broad, or probably your search terms are not specific. I should tell you that there's probably something wrong with either the research question or your search strategy. Right? So thus, just bear this in mind. We have different types of research questions. We have therapeutic ones, questions like inpatient living in long-term. So these are some of the questions for treatment. Now, the advantage of understanding the type of questions you are asking is that it makes your work easier. You in advance will know the type of studies to include in your systematic review. But for example, this type of question, you quickly know that this type of question, you need randomized control trial or before and after studies. But of course, randomized control trial is superior, right? So once you know the type of questions you are asking, that your life becomes easier. They know the type of studies you need to answer the questions. If you don't know it becomes very difficult, because when you do your search, different study designs come up. But once you know that this type of question, the best study design you need is this, then you try to ignore all other study designs and concentrate on that type of study design. So it's always important to know the type of research question that you are asking. It could be preventive, which is very similar to the treatment. In that case, you need other, in addition to the RCTs, you also need a prospective study design. If your study question is on diagnosis, you need RCTs or cohort studies. But mind you, sometimes anytime you have a prospective study design or a cohort study design, then sometimes you may need some of the quasi experimental designs. You may also be thinking about them. And if it's on forecast, the type of questions you need. These are general rules, because I remember there was a question that we answered when I was in Finland. We wanted to know whether mood and dampness increases the risk of onset of asthma. In this case, we need a special type of observational studies, a cohort studies, not any case control study, but we needed incidence case control, because we're talking about new cases. So all those are general rules that if you have a prognosis question, it means you need a cohort study, a case control, but it depends. Sometimes you need a question deals with new diseases. You can't get new diseases in prevalent studies, like prevalent case control studies or causal studies. You can get new diseases from cohort studies or follow-up studies, and also incidence case control studies. So all of these are generic rules, but you also have to think about the structure of the question. Right? But this helps a lot. It helps you to get rid of other study designs, and it makes your work a bit easier. Yes, sometimes you have questions on etiology. Different, what you need are cohort studies. Right. So knowing the type of question you are asking is also very helpful. It reduces the challenges you might have gone through, right? So let's assume that you do a search in PubMed, you get about 10,000 hits. Then you know if your questions are in etiology, they know that you don't need RCTs, you don't need prevalence case control studies, but you need cohort studies. Then it's easy to easily delete all the other study designs and keep this one before you start the other screening. Right? It's always very important to know the type of study, the type of research question you are asking. Now, we've been talking about optimum research question or well-formulated research question. It's quite ambiguous, but however, we have guidelines for formulating appropriate research questions or answerable research questions, or well-formulated research questions. We have guidelines. I'm sure most of you are familiar with the guidelines. You have the PICO statement. Means that some components, the question should be able to identify the population. If it's an intervention, the question should be able to identify the intervention. The comparator is not always necessary, but at least the question should be able to identify the outcome. Now, so a good question is a question or an answerable question, a well-formulated question, is a research question that can define the population. You look at the question and you can easily identify the population. You look at a question, you can easily identify the intervention or the exposure. You look at a question and sometimes you can identify the comparator, not always, but it's a must. You should be able to identify the outcome. So if you come across, at least, I'm sure most of you have started reading systematic reviews. Now look at the research question that's have been formulated and see if you can identify any of these concepts. Whether the population can be easily identified, whether the exposure or the intervention, if it's an intervention, can easily be identified, the comparator not always, but especially the outcome, whether you can get all these 3 or 2 elements in the research question. Once you have all these components in the research question, then we say the question is answerable or is well formulated. So be it your primary studies that you do, or you'll be doing, or you are doing, or systematic review that you aim at doing, once you get your research question, you formulate your research question, then have to make sure that it captures each component of the PICO statement. There are exceptions, however. For example, if I want to do a systematic review of prevalence studies, then we'll look at that one later, not now. Prevalence studies might not always satisfy the criteria, but it's a generic format that every research question, a good research question, should have these components. What characteristics of the patient or population are you interested in? Is it the age, gender? It should be specified in the question. Whatever characteristics of the population or the problem you are interested in should be specified in the question. What type of intervention should also be specified. Whether you are interested in the dose or the concentration, it should always be specified in the research question, right? So there should be some element of exposure or intervention in the question. The comparators, as I said, it's not compulsory. You can have research questions without them. By default, they are implied anyway. But the outcome should be specified. So once you have all these components reflecting in your research question, as I said earlier on, then we'll say you have an optimum. You have developed or formulated an optimum research question for the exercise, or a well-formulated or answerable research question. I have picked samples from a different medical journal and other places. Unfortunately, most of my examples is a bit biased towards the health sciences, but I'm sure it's applicable in other areas. There are other variants to PICO. You can have PICOs. The first one was PICO, population, intervention, or exposure. I'm sure the way I've written it, you understand it. Sometimes you have population, intervention, comparator, and outcome when you have an intervention studies. But if it's an exposure outcome study, then you are no more dealing with intervention, but you are dealing with exposure, right? It becomes PGCO. Right? If it's an intervention, it's PICO. That's why I kept the Y in brackets all the time, right? It could be intervention or exposure outcome study. We can have variants of the PICO. Sometimes the question will require that you also state the design, the study design, whether a cohort study, a case control study, sometimes a study design should be specified, right, in the PICO statements. Sometimes the time frame should also be specified. In this case, it could be PICOT or PGCOT. Please don't get confused with the G in the brackets. If it's an exposure, it's a G. If exposure outcome study is a G. If it's an intervention, it's an I, right? So sometimes you can have PICOT, right, where you need to also consider the time frame within the concepts. Sometimes it can be PICOC, where you need to also think about the context. But we have other variants for qualitative designs, the SPIDER and the SPICE. There are some reviews that they've compared the sensitivity of the PICO and the SPIDER, and they claim that the PICO seems to do very well in qualitative study. It does better than the SPIDER, although the SPIDER was originally designed for qualitative studies, right? So whether you are using SPIDER or PICO doesn't really matter, but that's how some reviews have come up with. And so, yes, SPIDER, SPICE, they're all for qualitative, other forms of study designs. Now I want to look at examples of how to formulate an answerable research question. Our first question is from a medical literature, a very popular one. So as when you go to the hospital, you are confronted with a case, and the child's symptoms is getting worse. And as a doctor, you are not too sure whether to give the person one drug or the other to reduce the length of stay in hospital. And these are events that happens in the hospital all the time. Some they have a patient whose health conditions is deteriorating. You are not too sure whether to give him a drug A or drug B. And I'm not too sure whether you have the luxury to conduct a systematic review, but you can always fall on existing reviews and existing reviews to make a decision. So very credible reviews will easily help the doctor in his consulting room to make a decision. So a typical question: a 4-month-old baby was admitted to a hospital ward with a viral bronchiolitis. The child's symptoms got progressively worse, and the doctor was wondering whether to give a steroid might help the child improve and reduce the length of stay in hospital. Right, this is measured with a clinical score. A clinical score is used to measure improvement in the child situation. So this is a classical case where, for example, for you to do any systematic review, there should always be a problem. You can't just get it from vacuum, from the Bluetooth. Yes, I want to do a systematic review. There should be a problem you want to investigate or you want to report on. So this is a classical example where doctors go to the hospital and they are torn between using a drug A or a drug B. You can decide to do a systematic review or further meta-analysis to make easier decision processes in the hospital. So how do you formulate a very well-organized, an answerable research question from this? As I said, this is a very popular scenario. I think it's in the medical literature. Now, first, let's identify the problem. So let's go back. The problem is the problem in this case, or the patient, is a 4-month-old baby with a viral condition, right? So the problem is for every problem, you should to identify the population or the patient or the actual problem, right? So in this case, the problem with the patient is a 4-month-old baby with a viral condition. Now, what is intervention? Intervention is to give the person a steroid, corticosteroids. Although it's not too clear whether there's a comparator. As I said, a comparator sometimes, by default, you have the comparator will be not given at all. Although it's not in the question, right? The comparator will be not given at all. Then the outcome will be a clinical score or length of hospital stay. So we've been able to identify your key concepts, your PICO statements, your key concepts or the PICO statements from your research problem. Once you're able to do that, then you can easily turn this into an answerable question. So a classical answerable question is, in a 4-month-old baby with viral bronchiolitis, does the administration of corticosteroids compared with not giving the drug reduce the length of hospital stay? And we are saying a good research question, an answerable research question, is the one that has all the different concepts in PICO. If you look at this research question, we have the population or the patient or the problem. That's a 4-month-old baby with the problem. We can also identify the intervention, then the outcome. Because these elements are very obvious in this question. But the guideline will say this is an answerable question. It's a well-formulated question. As I said from the beginning, if you chance on any systematic review, try and see if you can identify these elements in the research question. The questions should not necessarily be structured this way. But what is key is that you should be able to identify the problem or the population or the patient. You should be able to identify the intervention of the exposure, and sometimes the comparator, not all the time, and most importantly, the outcome. So these key element concepts you should be able to identify them in the research question. Anything short of that suggests that a research question is incomplete or is unanswerable. There are exceptions, right? As I said from the beginning, sometimes if we're doing a prevalence meta-analysis, then you don't meet all of them. You meet 1 or 2. By general, this is the rule, that a research question should always have these components in. The other one that you want to look at, this is also very popular, but we will quickly move into the unknown very soon. Sorry. An overweight woman in her 40s has never traveled by airplane before. She's planning an anniversary holiday with her husband, including several long flights. She's concerned about the risk of deep vein thrombosis. She would like to know if compression stockings are effective in preventing this condition, or whether a few exercises during the flight would be enough. So for example, this could be a problem worth investigating, right? When, at least if you have an experience or you have a relative who has an experience like this, you can decide to do a meta-analysis to answer the question yourself. Or if there's if you read a narrative review and you think there's a gap that is begging for an answer, you can conduct a systematic review on this. Right. So first, like we did for case study 1, we need to identify the problem of the population, then the intervention, if it's not exposure, then the comparator, and then the outcome. Once we are able to do this, then we can convert the PICO statement into an answerable research question. Then we move on. So let's see. In this case, the P is a female middle age overweight. I'm sure you all agree. In her 40s middle age. And this is a very good description of the patients. Then the intervention. She would like to know if compression stockings, so that's what she intends doing, right? So compression stockings becomes intervention, but there's an alternative that she knows of. In-flight exercise. So in-flight exercise becomes a comparator, right? Then the outcome is deep vein thrombosis. Now, once you've been able to identify all the concepts, the next thing you do is to formulate your research question. Now, the previous one, it was impossible to identify the comparator. By default, the comparator was embedded in the question. But in this case, the comparator is visible, right? So let's move to the research question. Would be, in a middle-aged overweight female, is wearing a compression stockings effective in preventing deep vein thrombosis compared to in-flight exercise? You see, that's very straightforward, very directed, and you can always identify the different components of PICO. So thus we say it's an answerable research question. I hope we are on the same page. If you have any issue, just let me know. Now, if there's a need to go about, do that. Rosalind, is everything fine?
Yes, we are okay.
Okay.
Yeah.
And now there's another one. Okay, so current guidelines, case 3. Current guidelines indicate that nicotine replacement therapies, NRTs, should be used as an intervention in young smokers. Counseling is generally the recommended best practice for young smokers. However, youth who are at high risk of smoking often live in regional or remote communities with limited access to counseling services. You have been funded to review the evidence for the effectiveness of RCTs for smoking cessation in Australian youth to update the guidelines. So this could be a typical national issue. What it means that probably the guideline has never considered this. Then we've been tasked to conduct a SMART review. And either SMART review will support otherwise. Then once they get a favorable result, those could be inculcated in the guideline. And this happens a lot, especially in WHO meetings, right? Probably they may have a guideline, then there'll be new evidence. Then there'll be the need, a call for reviewing the evidence to see if there's the need to upgrade or downgrade. So these are things that happen, they happen around us all the time. And so like we did for the previous ones, let's see. So we need to identify the population, the intervention, if it's not an exposure, the comparator, if there's one, and the outcome. Okay. So our patients are adolescent smokers. I'm sure you all agree with me. And then the intervention is nicotine replacement therapy, because that's what you want to know, whether there's one in remote areas where they don't have counseling, whether this one is better. Then the comparator is the current program, right? So currently they've been using counseling. So whether NLTs perform or do better than, the NLTs will do better than counseling. And the outcome is smoking cessation, right? With the same as discontinued dependency on nicotine. Now we have all this. We've been able to identify our PICO statements or concepts from the question. Again, let's go back. I want to be sure you're on the same page. The guidelines say, the current guidelines get that nicotine replacement therapy should not be used as intervention in young smokers. So the population clearly defined. Counseling is generally the recommended best practice for young smokers. So counseling is what is being used. So it becomes the comparator. However, you two are at high rates of smoking, often live in regional or remote communities with limited access to counseling. Then you've been asked to review the evidence for the effectiveness of NLT. So NLTs become the new intervention. I'm sure you get a picture, right? How we identify the population, how we got an intervention, and then the comparator as well as the outcome from this case study. So the question now becomes, in adolescent smokers, you could say that the smokers are defined. Of course, you can say in smokers, and then you are looking at different population group. This, I don't think there's anything wrong with having sort of specifying the population. If you have an open, a very general population, and that will help you to do a more stratification if you want to do a meta-analysis to find out which population group is this NCTs, NLTs effective in. You can as well have an open population, right? But this one is very specific. That is fine. You can have an open population just in smokers, which is also very fine. So in adolescent smokers, how does nicotine replacement therapy compare with counseling affects smoking cessation, right? And you have your answerable or well-formulated research question. Why? Because it has all the components of PICOS. Now, this is from one of the reviews we did, and I think it was published in Environmental Perspective around 2017 or so. So this was the case study, case study 4. Arsenic poison of drinking water, air, food, and beverages affects more than 300 people worldwide. About 30 million Americans and 70 million Bangladeshis constitute this group. Many studies have linked arsenic in drinking water to poor pregnancy outcomes, although the evidence is inconsistent. A full systematic review of the issue was commissioned. The findings aim to clarify the potential risks associated with arsenic exposure during pregnancy and provide recommendations for public health interventions. This review also highlights gaps in existing research and suggests areas requiring further investigation to ensure the safety of drinking water. So it's thus, for example, could be a very critical issue that might require that you conduct a systematic review and possibly meta-analysis to answer a certain question. So first, we need to identify the population. So what is the population here? I'm sure because we are talking about pregnancy, you are thinking about pregnant women, which is correct, right? So in this case, the population is pregnant women. Now we don't have intervention, but we have exposure, E this time. So intervention is pregnant women. The exposure is arsenic in drinking water. The exposure is arsenic in drinking water. Although the comparator is not obvious, by default, you can compare with water free of arsenic, or sometimes water with low arsenic levels. In this case, any comparator is possible. This is true, especially if you are not so familiar with the area. If you're not too familiar with the area and you don't know the type of comparator that exists in the literature, it might be difficult. So it's best to open it up. So you allow for different comparison. Right. So in this case, you can say you are not so much interested in any particular comparison that is made within the studies. But I can list a number of them. Either water free of arsenic contamination, no comparator, or any comparator, right? I think that's how I'll go for any comparator. The outcome is obvious, adverse pregnancy outcomes, right? So we have quite a number of them. So you list all of them, right? So in this case, let's again move to this side. Let's read it carefully and see if we can easily derive our PICO state concepts, and give about 2 minutes to go through it carefully. When you finish, we move to the research question to see if there's any anomalies or a sync. It's in line with the case study. And the last bit, this review also highlight gaps in existing research and suggests future directions. It's not part of the problem, right? It's not part of the problem. But the main problem is what is being identified up there. But by default, definitely this is what the review is aiming at doing, to identify gaps in existing literature. Okay, so let's move on. I'm sure you now agree with me that we derived the right concepts from the case study. Now, what is the question now? Formulating the question should not be difficult, right? It's once you have it. In pregnant men who are exposed to arsenic through drinking water, are they at risk of experiencing adverse pregnancy outcomes? Of course, you can have different variants of the questions, but at least the question should always capture the key elements of PICOS. I'm sure you're all on the same page. Okay. Then the next case study. This is again another work, I think I don't know when this was published, but I think by 2015, when I was in Finland. I'll give you some time to read this before I do my reading. Okay. Indoor dampness and mold problems are common around the world, being one of the most important indoor problems globally. I'm sure in certain climates. In cold climate, the prevalence of water damage and dampness problems has varied between 5 to 30%, while in moderate and warm climates, the estimate have been 10 to 60%. So it's a global issue, isn't it? Thus, a substantial proportion of the world's population is exposed to dampness-related exposures. In 2004, the Institute of Medicine in the USA reported a review of literature and concluded that there is evidence of an association between indoor dampness-related exposures and the following outcomes, upper respiratory tract symptoms, cough, wheeze, asthma exacerbation. In addition, sufficient evidence was found between mold exposure and hypersensitivity pneumonitis. In a meta-analysis by Fisk, actually, the IOM, they did one, and then Fisk also did one later. In a meta-analysis by Fisk and co-workers, the risk of current asthma, the prevalent asthma, and never diagnosed asthma were significantly increased in relation to any dampness or mold as a combined exposure. But results on development of new asthma remained inconclusive, as only 4 studies had been published by then. Asthma is the most common chronic disease in children, and is also a common chronic disease in adults with prevalence about this in Western. There has been a debate on whether indoor dampness related exposure can cause asthma, a question which is of major public health and economic importance. If development of asthma could be prevented by prevention or repair of indoor dampness problem, this could lead to substantial savings in health care costs and improvement in public health. Thus, a systematic review mechanism is required to address this issue. The question, the actual problem is a bit scattered, right? So 2004, a review was done, then followed by another one by Fisk. By Fisk, they concentrated on prevalent current asthma or ever diagnosed asthma. However, there were 4 studies. The relation between any dampness or mold or any dampness indicators and onset of asthma was inconclusive because at that time only 4 studies were available. Now we want to know whether asthma has a relationship with new cases that is coming up, right? That is coming up. And so there's a need, whether the 4 studies from the previous study couldn't conclude on this. And I want to conduct another one to establish whether mold or dampness indicators have any association with onset of asthma. Now it's because the problem is scattered. Let's figure out how we will identify the population. Yes. Where do we get a population from? Or it's a global issue. So we are interested in every population. Then let's also identify our exposure. Our exposure is dampness and related exposure, or we can specify dampness and mold indicators. So any indicator that measures dampness, or any indicator that measures exposure to molds or dampness is what we are interested in. So dampness and mold related indicators are the exposures. I hope you're on the same page. The comparator is not too clear from this study, so we can open our comparator up, especially if we are not too familiar with the literature. We don't know whether studies have compared dampness against another exposure indoor or levels, or probably let's say less concentrated levels. We have no idea. So in that case, we can say we are interested in any comparator, because we are not too sure what type of comparison has been made in the studies. So we open it up. Now the outcome is onset of asthma or new cases of asthma, right? So even when the problem or the case study is scattered, you should be able to figure out where your population, the problem is, where the exposure is, where the comparator is, sometimes by default is there, and especially where the outcome or the outcomes are. It's always important. So the population or individuals of population, the exposure, indoor dampness or mold indicators, the comparator, I'll say any comparison, right? Then outcome is onset of asthma or new cases of asthma. I hope we are on the same page. Then the question, actually the original question that we have in +1 is what I copied here. And I want us to assess whether this question has any components of PCOS. And in +1, I'm sure this was published in +1. The objective was to assess the relations between indicators of indoor dampness and mold problems and the risk of developing new asthma. Let's check if we have all the PICO concepts here. Any population, the population is not too clear here. So let's see, population is negative. Exposure, yes, exposure is present. Indoor dampness and mold indicator. The outcome is present. It's new cases of asthma, developing new asthma is the outcome. However, by default, because it's a global issue, we can say population, any population exposed to this. But the question itself is implied, right? Now, so when you come across a review objective or question, the first you have to do is to try to understand whether the question identifies the population, the exposure, or the intervention, the comparator, not always necessary, and the outcome. Just check if these things are present. If they are present, then it means you have an answerable research question. I hope you're on the same page. This is another one that was published in the. I want us to figure out how to derive answerable research questions from a case or from a problem that you want to work on or produce a systematic review from. Right? So you always should be able. So this again was a paper that was published in Environment International. I think this was published in 2017 or so. It was on household air pollution. There has been several, I'm just giving a narrative. There have been several studies in LMICs trying to reduce air quality or improve indoor air quality and health outcomes. There have been several interventions, from behavioral interventions to technical interventions or the combination. But no study has been able to establish any evidence whether these interventions are effective in reducing indoor air quality indicators and at the same time improving health. So there was a need to carry out a systematic review to inform future directions, right? Co-founders needed this information, right, to at least to redefine the agenda on household air pollution interventions. I think around the same time, there were two papers that one from Pope's group from Liverpool University and the other one from our side. Now, for the sake of the PICO statements, sometimes the problem is not too clear, but of course, in your head, you know what the problem is. Right? Before you embark on this systematic review, you should have an idea what the problem is. Once you have that idea, that thing concretized in your head, you'll be able to identify the different concepts of PICOS. So nearly 1/3 of the world's population use solid fuels such as wood, animal dung, crop residues as their primary source of domestic energy use. Cooking and heating with solid fuel on open fires or traditional stoves emits a complex mix of organic compounds and gases, which include the following: up to free radicals. Health problems associated with household air pollution from solid fuel use include, but not limited, respiratory infection, lung inflammation, conditions, cardiac events, asthma, and so forth, up to tuberculosis. Cook stove intervention programs have been implemented and studied extensively in LMICs. However, there remains significant uncertainty regarding the effectiveness of these interventions. So a systematic review is needed to determine the effectiveness of these interventions. So it could be a drug, it could be any discipline. You want to understand whether the number of interventions that have been implemented are effective and which intervention is the most effective. And then other heterogeneity issues will follow. But you want to answer the question whether intervention A, just like we did for the hospital case, you want to understand whether these interventions are effective enough. In other case, what I will entreat you is try to define in your head the type of research question. Then quickly you'll know the type of study designs you will need, right? So for every question that you formulate, have an idea. Ask yourself, what type of research question is this? Is it prognosis? Is it preventive? Is it treatment? Have an idea what type of question you are dealing with. And the burden will be lessened once you know the number of studies involved. The burden is lessened. So again, this is a global issue in LMICs. So you are dealing with households in LMICs or the population in LMICs. Intervention is interventions targeted at improving household air quality. Right, so interventions target at improving household air quality in the LMICs. Assuming that you are not too familiar with all the type of interventions, or you think you don't have enough studies for specific interventions, so you can't target on specific intervention. So you're looking at all the interventions to see if they've been effective, which is the most effective. The comparator by default, any comparison. Then your outcome, you have two types of outcomes. You have exposure outcomes, which are indoor air quality indicators, and health outcomes, which are the list we have here. Chronic COPD, low birth. So we have two types of outcomes here. So you can decide to have one as a primary. Of course, intuitively, indoor air quality, which gives rise to the health outcomes, should be the primary outcome. Then the actual health outcomes could be the secondary outcome. Because once the levels are high, definitely we know certain disease or health outcomes will follow. So the exposure outcomes could be the primary, the health outcome could be the second. Now, I'm sure this sits well, how we derive these concepts from the PICO statement. You can have different, probably the description might be different, but the idea should be the same. The description of what the population is, what the intervention is, what the comparator is, the outcome is, might be different in wording, but the idea should always be the same. Doesn't mean that that's the only way to present it, right? No, you can use your own, what you think is good for you, and present the language that sounds better for you. But the idea should always be the same. The idea is that you need population, you need intervention, you need comparator, you need the outcome. And that should always be present. Now let's see the research question. Again, the research question, again, depends on what you are used to, right? So we frame it a different way. Are interventions for household air pollution effective in reducing the indoor air quality indicators and improving health outcomes? household LMICs. It could be stated differently, but the whole idea is to have the most important things. So this is the last one, the last case study, I guess, that you're going to look at. This is from a work I did for the WHO. This work in particular was not published, but I think we were about 8-7 groups. I don't remember the groups. And then a review report was produced. There's some people, I think I didn't have enough time to, but of course, some people did that. Yeah, we have those as a preprint, but we didn't follow to the end. I think that at that time there were other commitments. Now let's look at this carefully. About 90% of S. hematobium and S. mansoni cases in the world are reported in Africa. Schistosomiasis morbidity include diarrhea, blood in stool, or blood in blood, diarrhea, abdominal pain, enlargement, blah, 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 blah. Up to reduced cognitive ability. So these are some of the event that follows when you are exposed to when you are infected with this. In 2001, the 54th World Health Assembly endorsed resolution WHA 0.19 for mass and regular treatment of high-risk groups, particularly school-age children with preventive chemotherapy to reduce mortality and morbidity and ensure access to single-dose drugs against schistosomiasis to achieve minimum targets of regular administration of chemotherapy to at least 70% and up to 100% of 4 school-age children at risk of morbidity by 2010. So this was what was enshrined in the resolution. The strategy was revised in 2006 to include adults at risk from special groups to entire communities living in high endemic areas. Targets were not met, and in 2010, only 30 countries out of 52 requiring PC's preventive chemotherapy had implemented mass treatments campaigns with coverage ranging from 4% to 27.5%. The current revised guideline endorses regular mass drug administration of targeted groups over a few years to reduce and prevent morbidity and the insurgence of irreversible pathology in adulthood. The guidelines have already been revised a few times in the initiation of PC strategy. A recent meeting of experts in Geneva in 2016 called WHO to develop new evidence-based guidelines and procedures for countries to evaluate the PC strategy. But the question which population groups should be targeted for preventive chemotherapy to control severe and subtle morbidity for schistosomiasis that to achieve maximum benefit largely remains. So this was what I worked on. So I think that the question is very clear. It's even stated at the bottom. So I'm sure you all understand the case. Now, new evidence has emerged, and the WHO is mandated, among all the things they have to do for the guideline. One of the things where the target to do is to define which population should be targeted for PC to control the condition. So in this case, the PICO statement is very clear. The population is every population, or how you define it, include everybody. That's what I mean, everybody. Then in this case, the preventive chemotherapy was praziquantel. So PZQ. And then the comparator, because at that time, not much is known about a different comparison, the research was open to any comparator. The research was open to any comparator. Then the outcome is severe and subtle morbidity. Severe. Hey, we've gone beyond Jessica, we've gone beyond by 2 minutes.
Yes, please.
Oh, so those are the questions. I think let me speed up a bit. What population group should be given praziquantel for the purpose of controlling severe and suboptimal schistosomiasis? So this is a research question, right? Now, assuming you are okay with your research question, is that the end? No, that's not the end. First, you need to find out whether this research question has been answered elsewhere. So what will you do? You have to go to different databases and also databases that registers systematic review meta-analysis. Go to different databases to check whether somebody is working on this topic or whether something has been done already. If the answer is yes, you have to go back to your research question. You don't have to damp your spirits. Go back to your research question or read those articles critically and find out if you can identify a gap for your work. But if it's no, then that's very good. It means you can go ahead with your research. If it is no, then you have to search for articles, have an idea what going on with primary studies. Your target is human beings, but with this, your target is studies. The question is, will you get enough studies to answer the question? So that is the next phase. If you don't have enough studies for this question, then you can't do the systematic review at all. So once you've shown that there's no previous systematic review or an ongoing systematic review, the next thing that you have to do is to search for some evidence, where there are some evidence, some studies that can help you answer the research question. As you get the studies, read them and modify your research question. So this is an ongoing process. You read, you search, you read, you modify your research question. So the time you get to a point where you are satisfied, the team is satisfied with the research question. Once you are satisfied with the research question, then straight go ahead and develop your protocols. And these are areas you can search. You can search in Prospero, Cochrane Register of Cochrane Trials, several databases. You can also, we have the I always have challenges pronouncing Epistomonicos. It's a free resource which registers all systematic reviews. You can go there to see if there's anything deposited there. Google Scholar. So search as many reviews as you can to verify whether anybody is working or has worked on this topic. As I say, if somebody has worked on this topic, don't worry. Read their reviews and check if you can get a gap to fill. If nobody has done anything, then you have to remold your research question until you get something that you are satisfied with. Then you register, you develop your protocol. You can submit your protocol for publication. There are quite a number of outlets that accept protocols for systematic reviews. Or first, you can register it in any of these outlets. Prospero is one of them. You can always register. Now, in summary, you've learned how to use a guideline to develop your research question. And then after getting your research question, how to verify whether your research has been done already or the question has been answered already. Now, if the answer is no, and you have established, you have developed your protocol, the next question is, how do I turn my questions into search strategy? I'll take about 10 minutes to finish this. I'll move, just give me 10 more minutes and we'll be done. You turn your research questions into search strategy. So now we have your research question. The search strategy is, a lot of planning has to go into it. The first you have to think about is, what databases am I going to search in? Right? Am I interested in Gray literature? If we're either interested in Gray literature, then there are some databases you can consult. So these things has to be taught about in advance. Once you get your questions, you are happy with it, the next step you do is what databases or what database. It's recommended that you use as many databases as possible. And that will build will at least will enhance, will reduce publication bias, and then the people wouldn't have problem with your results. Right? So you search as many databases, at least, if not at all, at least 2 databases. But you can do more. Search as, so identify your databases. Then the next thing you have to do, so there are some, if we're doing something on Africa or in Africa, don't forget about regional databases. You also can locate subject-specific databases. So all these things have to be agreed on by the team, right? So if one grade literature, these are some of the areas database you can identify them. If it's peer review articles, we have either multidisciplinary or the subject-specific databases. So you have to agree on what database to search in. Once you are fine with a database to search in, then the next thing is to work on your search strategy. I'll come to those later, but let's go forward a bit. Let's use some examples. Now we are using the hospital scenario. So for example, we are still, as I said, the research question is a building block of everything you are doing in the systematic review. Now you have the concept 1, that's the population, concept 2 is the intervention, and concept 3 is the outcome. Now what you do in each case is that if you take concept 1, that's a viral bronchitis, you look for synonyms. What are the synonyms of viral bronchitis? That's the more reason why you need a subject area expert. So a subject area expert will help you identify some text, synonyms, and so forth that you need for each of the concepts. And I would suggest that if you are a beginner, what you can do is that, for example, if I'm working on viral bronchitis, I will look for another paper. If it's on air pollution and viral bronchitis, then I'll look for another paper, let's say pesticides and viral bronchitis. And then I'll look for the term that was used for viral bronchitis in that paper. But the paper has gone through very rigorous review. I'm assuming that any concept, synonyms, text, anything that they've come up with is worth using. So a beginner, you can adapt and modify. But it's always good to have a subject area expert who will guide some of these things, right? So you come to the intervention, you look for synonyms, you look for text, and so forth of the concept 2. You do the same thing for concept 3, the outcome. What are the synonyms? What are the keywords? What are the texts that are similar to the concept? So for example, clinical score, length of hospital stay. Length of hospital stay probably might be similar to, no, let's look at concept 2. Corticosteroids might be used at the steroids and the other families could be synonyms, and we can use them. And then the concept 1, the same thing. We have quite a number of bronchitis viral and the viral bronchitis. So these are all synonyms. So it's always good to get a subject area expert who can guide some of this. They're always important. If you don't have any, you are a student, the supervisor will always help. If your supervisor does not work in this area, you can always consult a colleague or a faculty member who can help you achieve the same aim. Now, once you develop, so after identifying the databases, now you develop keywords, search terms, and synonyms for each concept. When I say concept, I mean the population, intervention, outcome, and comparator. Those are concepts. For so each concept, you develop a list of items that are similar in the literature. That are similar in the literature that you can also. Then let's look at this one. The first concept is pregnant women. The second concept is arsenic in drinking water, or arsenic. a comparator is no comparator, and the outcomes are several. Now, if you look at this carefully, you'll see that it's all pregnant women who have adverse pregnancy outcomes. So you can see that concept 1, concept 3 are the same. But however, for a novice, you can develop synonyms, text, keywords, and so forth for concept 1, concept 2. But you are overworking yourself. But a more experienced person will know that concept 1 and concept 3 are the same. But if you do for concept 1, concept 2, concept 3, and you combine them, yes, you will not go wrong. You get the same answer as using only 2 and 3. Now, so for example, I assume that 1 is embedded in 3. So in concept 2, arsenic, arsenicals, arsenites, arsenates are some of the terms that are similar to arsenic. Now, adverse pregnancy outcomes, you have obstetric complications, pregnancy disorders, maternal obstetric complications, and so forth and so forth. These are all synonyms to adverse pregnancy outcomes. Then you come to the adverse pregnancy outcome. So you want to, for example, if you do a search, every author produces a keywords, and there are certain terms in the manuscript. So when you do a search, the words that you put into a database, those words are identified in the manuscripts. And so if you leave out some text or keywords, they are not picked. But so that's more reason why you want to use keywords from the manuscript. So how are these things used in previous manuscripts? And what outcomes? If you say adverse pregnancy outcomes, what outcomes are you making reference to? So that once you develop the search strategy for concept 1, concept 2, concept 3, the next thing you do, we're going to talk about, is how to combine them. We use the Boolean operators, which of course we are all familiar with. Well, so we've all done Venn diagram. So a quick one, when you say A or B, you mean this side or this side, or both. When you say A and B, you are referring to the shaded area, the intersection. And you say this and not this, you are referring to all of this. So you will make use of this Boolean logic to combine the concepts. So for example, I'm sure these are things you guys are familiar with. So when you say or, we use or to combine keywords or concepts, keywords or terms in the same concept, but they are similar. We use and to combine concept 1 and concept 2. So for example, yes, sometimes in other databases, we use question marks because we have the way the Americans spell color and with the British spell color. You can write polo question mark R, which means you accept both America's spellings and the British spellings. And also the hash sign. In some cases, organization is a Z, in some cases S. Especially in Ovid, it recognizes the hash. So if you put hash here, instead of writing the full S or Z, Z is identified, S is identified. Don't forget some abbreviations. For example, in some preterm delivery could be written as PTD. So when you are including that in your concept, don't forget to use also abbreviations. If you write preterm delivery, you should also write PTD because it's also an acceptable term. So also don't forget abbreviation. And in some journals, Ovid and so forth, they also believe in truncation. When you put asterisks, it means anything that begins from any word that has pollutes and has different words following will be picked. For example, pollution, ION signifying the asterisk, pollutant, ANT signifying the asterisk, and ING also. So anything that ends with T, anything that follows, any word that ends with a T, POLUT, if it has any other word following, it will be picked. So these are some of the strategy that is used in other databases. Now, let's make use of our concepts, our Boolean knowledge. We have concept one, so we combine whatever is in concept one together, Bunculitis varia or variable Bunculitis. But when it comes between concepts, we join them with and. So concept one and concept two and concept three. But the content of the concept are joined with by or. I hope you follow me. So whatever you have in the concept, you combine with or. But if you want to join two concepts together, you join with and. For example, in pregnant women, we join arsenic or arsenicals or arsenite or arsenate. We assume that pregnant women will give the same result as adverse pregnancy outcomes. And then concept three, adverse pregnancy outcomes or obstetric complications and so forth and so forth. But you have concept one and concept two being joined by and. The same thing applies to this as well. So once you have developed your search strategy, the next thing is how do you apply them in a database? And that will be a discussion for our next meeting. Sorry for consuming your time. Sorry for that. I shut my phone. I was not following it. Okay, sorry for that. I've eaten into your time for about several minutes, isn't it? So thank you very much. And this is all that time will permit us. Thank you. Over to you, Rosalind.
Thank you very much, Doug, for taking the time to accommodate us today. We are very grateful, and on behalf of SRN, we'd like to thank every participant that has stayed or attendee that has stayed with us up to this time. It shows how much passion you have for systematic reviews and meta-analysis, as well as the content that was being taught today. We hope to take the session over some other time from where Doug has stopped. And we have shared our social media handles where you can join us and follow up with recordings for such sessions. The session today and the materials will be shared over these social media handles. So if we do not have questions.
Oh, sorry, Laura, can you hear me, Rose?
Yes, please.
Yeah, Dr. Regina, thank you very much for the very insightful presentation. I was wondering if you would like to take maybe one or two questions. We still have about 10 minutes.
Okay,
yeah, okay, great. So please, if you have a question, can you share with us in the chat box, or you can raise your hand and we can unmute you to speak. Oh, okay, good. So we would
there's a hand up.
hear from Laima. Laima, go ahead with your question, please.
Thank you. So my clarification is on the slide, which is just showing in front of us. So when we are structuring the search strategy with the Boolean logic, so are those Boolean words supposed to be in capitals? I think that's my clarification. Thank you.
Should I answer?
Oh, yeah, please. Yes.
Not necessarily. I think in PubMed, for example, if you use the advanced search, it has both capital and in most databases, you only have to identify the concepts and then you click on and or. So as you add, for example, in PubMed, as you add one term, you click on all, you add the others. Once you are done with the concept, you click on end. So by default, the end and the all are embedded in the database, which you can select.
Okay, thank you. Can I go ahead kindly?
Yes, patients. I've
Yes,
seen two
please.
hands up.
All right, this is Catherine. I didn't hear anybody call my name, and I thought now everybody was done asking their question. My clarification from Prof is on the PICO or PICO concept. I realized there is a time that you are using the E other than the I when it comes to the PICO. I don't know whether I'm pronouncing it correctly. And
That's
so
correct.
I needed that clarification because I was still struggling. Like when we were looking at the case study on the solid fuels and the cook stove intervention programs and all that. I don't know whether we can go back to that slide, but if we can't, my clarification was asking,
Is it the variant?
sorry?
Is this the variant of, is it
Yes,
this one? Okay.
yes, this one.
Okay.
So I wanted a clarification. When do you decide whether you are looking at the intervention or the exposure, or whether to use the I or E? You know, like for
Okay.
example, that case study that we were looking at, I went
Okay.
through it and I tried to scribble something down to look at what are the variants or what are we looking at in terms of what is the population, what is the exposure, what is the comparator and outcomes. But what I had written down versus what you gave us, you went to the E rather than the I. So that is the clarification that I was seeking kindly.
Okay. Thank you very much. I think some of the studies as I showed you, there were intervention studies. For example, in household air pollution, they want to see if there's been several interventions that have been implemented in the past. They want to see whether these interventions have been effective. So in this case, because you are there with interventions, it's PICO. But in the case of the mold and dampness, they were looking at the association between dampness and mold indicators and new case of asthma. Because it's an exposure outcome relationship, they are dealing with E, exposure. Is that clear? Anytime you are dealing with exposures, if it's an intervention is when you intervene, right? You intervene in a situation either to get an adverse or benefit something. Anytime you intervene, it's an intervention. So if the study, your purpose is to look at studies that have intervened in a situation, then it's PICO. But if you want to look at the relationship between what one has been exposed to and the outcome of exposure or the disease, is more of an exposure outcome study. Then you are done with E, then in that case, PICO. If it's intervention, I, if it's not intervention, exposure is E. I'm not too sure if I've answered your question.
Oh, okay. So I think we can still take one more question. Wenga Lufi-san.
Okay, can you hear me?
Yes.
Okay, thank you so much. Prof, I really appreciate your explanation. It was so detailed. Thank you so much. More importantly, because you touched on Spider. I am currently doing a review using Spider, and I'm a sociologist. I'm social sciences, definitely. So that was why I was using Spider to look at adoption. Like what I'm working on is on adoption of a particular technology. So can you please explain more about Spider? Because I'm new to systematic review generally. I just saw that I saw a paper and then I was influenced to do something on that paper that I'm working on right now. And also, I want you to please explain, because you touched on spies, which I don't think I know anything about. And you mentioned that it's very much like a Spider, that they both look at qualitative published works. So please, can you explain a little bit more on that? Thank you, sir.
Okay. Please, your name.
My name is Bengailu Fison.
Okay, so I'll take my email address from Fortune, then we'll discuss the use of Spider. Is that okay? Because of the
That
time.
would be great, sir. Thank you so much,
take
sir.
my email from Fortune or Rosalind.
Okay, thank you, sir.
Dr. Regina, please, would you want us to share it now in the chat box, or maybe later upon request?
Yes.
Upon request, or we can share it now?
Which one? Show the chat.
Yeah, I'm saying if we can share your email in the chat box now.
Oh yeah, you can share my email in the chat box. That's fine.
Oh, okay, great. Oh, okay. Thank you very much, everybody. We've shared a link to a social media platform in the chat box. Just we're encouraging you to follow us across our platforms, because we organize webinars and workshops that are more practical and engaging. And we also organize mentorship programs guiding early career researchers to publish their systematic reviews. So you get to know the activities that we have coming up in our platform and in the events page of our website. So encouraging you to join. And also we share a couple of opportunities for researchers in our WhatsApp community platform. So I believe it will be very, very helpful for you. So this event is in partnership with AuthorHead. We've also shared AuthorHead handles on the platform. We've shared the email of the facilitator. Unfortunately, because of time, would not be able to take more questions. So please, you can send him an email, or you could also write to us at info@systematicreviewsnetwork.org. All right, thank you very much, everybody. Over to you, Rose. Dr. Regina, do you have some final words?
No.
Okay. All right, thank you. Rose,
Okay,
I see there.
Okay.
Okay. Oh, go ahead. Go ahead, Rose.
I was just about to thank everyone, and especially the facilitator, and agreeing with every other thing you have said, and to close the webinar for today. Thank you.
Okay, sorry, I was wondering if you could do some group photographs. So if it's comfortable for you, you can put on your screen, and we'd like to take a group photograph. Dr. Regina, please, can you stop sharing your slides so we can? Yeah, thank you. All right, great. So After the count of 3, I'll start taking the photograph. It's good to see your beautiful faces and handsome faces. 1, 2, 3. So we take the first one. Oh, take another one. Thank you for joining. We take another one. Okay. All right, thank you very much. Like Rose said, we would be sharing this recording across to our emails, but unfortunately, it will only come into those that registered for the event. We'll also be sharing the slides with you, and of course, we'll share post-workshop survey. I'm encouraging you to fill it. We'll also be sharing a link to our platforms, including our WhatsApp community platform. Thank you, everybody, once again, and see you next time.
Okay.